Hey, Palaash, let's go. Look.
Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm so excited because I have a new co-instructor here. This is Palaash, and Palaash is 12 years old. He has autism. We have his mother, Nemu, who's here to help.
Hi.
And Palaash is able to communicate by typing in his requests. So he uses a QWERTY keypad. Is just able to type what he wants, but he's unable to speak. And his family is really wanting him to develop his oral motor skills for speech. So we are using the Weber oral motor photo cards to be able to practice the motor planning and the strength required to be able to speak. So in speech, one of the movements that comes later is lateral movements. And understandably, Palaash is having more trouble with the lateral movements of his tongue. So we're going to do 2 cards. These are a little bit tricky. He hasn't mastered these yet, but let's see how they go.
Hi. We're going to start with the tongue tip side stretch. It's the lateral movement of the tongue. Stick your tongue out to the left side of your mouth and repeat it on the right side. Okay. So we're going to start. I use a tongue depressor, trying to give some support on the side.
He's going a little bit without you touching.
Yeah, he's just going a little bit right now, but he doesn't have the skill yet. So we are going to just be practicing this one. So 1, 2, 3, 4, 5. Palaash, we're going to do 5, and then, yeah.
Go ahead. Well, when we first started this, we were actually taking a Kleenex and holding onto his tongue and pulling it off to the side. And
Yes.
then he started using his own finger to be able to push it to one side and the other. So we're trying to fade out the actual physical touch cues and using not our finger or not directly on, but just cueing him with the tongue depressor. Thank you.
Yes.
All right,
And
next.
The next one is touch tip to inside cheek. Push your right cheek out with the tip of your tongue and repeat it on the left side. So here I'm just going to help him to push his cheek once, and he's able to, okay, 1, 2, 3, push it, Palaash, 4, and 5. And the other side here, Palaash. Okay, on the left side, all the way. Yes, 1, 2,
Beautiful.
3. Good job. 4 and 5.
Now, oh, sorry, go ahead.
Push your right cheek out with the tip of your tongue. Repeat it on the left side.
I love how you read it first. We do
Yes.
the action and then you read it again. I think that really helps
So
him.
it's more because he likes to read, and he's able to also process or understand what is expected to do. So that's the reason I'm reading it out before and after, kind of a reinforcer for him.
Right, and you usually do 10 repetitions.
Yes, we
but-
generally do 10 repetitions, but we are just, to show, we are just doing 5 right now.
And I really would have thought that inside the mouth was going to be harder, but it looked like he was having an easier time.
Yes, it's also because I think he's using his teeth to give a support for his tongue, which he's not able to use when it's the lateral movement of the tongue. That's my thinking, but it could be just that it's an easier step for him versus moving the tongue laterally.
A year ago when we were working on this, we were not even doing the second one. We were only doing the outside one. So that's
Yes.
remarkable progress.
Yes, it's been almost 2 years that we are working on.
And
on
you
the
say
same
you do this
balancing.
once to twice a day.
Yes, yes. It's more or less once a day minimum, or there are days when we do 3 times a day. But yeah, at least once a day is what we do.
I hope this is helpful, and we'll
Thank
look
you.
forward to seeing you next time. Thanks a lot. Bye-bye.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.